Intermediate to long-term outcomes of endoscopic transpapillary gallbladder stenting in patients with gallstone-related disease, a 10-year single-center experience. Introduction. Endoscopic gallbladder drainage has been recently proposed as an alternative treatment strategy to percutaneous cholecystostomy in patients with symptomatic gallbladder disease who are at high surgical risk or whose cholecystectomy is deferred, thus avoiding the adverse events associated with percutaneous cholecystostomy, such as tube dislodgement and leakage, which occur in up to 20% of cases. Endoscopic drainage includes endoscopic transpapillary gallbladder stenting, ETGS, and endoscopic ultrasound-guided transmural gallbladder stenting. ETGS provides an effective bridging therapy to elective cholecystectomy in patients who are scheduled for future cholecystectomy, owing to its ability to preserve gallbladder anatomy, and can also serve as an appropriate treatment option in patients at high surgical risk who require permanent gallbladder drainage but have contraindications to percutaneous cholecystostomy and endoscopic ultrasound-guided transmural gallbladder stenting. The author's retrospective study aimed to investigate the biliary event-free rates at 6-month follow-up, intermediate term, and more than 6 months follow-up, long-term, after ETGS in patients with gallstone-related disease who were at high surgical risk or whose cholecystectomy was deferred. Background. Endoscopic transpapillary gallbladder stenting, ETGS, can be a bridging therapy to elective cholecystectomy or a permanent gallbladder drainage method in patients with symptomatic gallbladder disease who are awaiting cholecystectomy or are unfit for surgery, respectively. The authors evaluated the intermediate to long-term outcomes of ETGS in these groups. Methods. The authors retrospectively reviewed 234 patients, acute cholecystitis equal 147, who were unfit for surgery or had deferred cholecystectomy and who underwent ETGS between 2012 and 2021. A 7 French 15-centimeter double pigtail plastic stent was placed for ETGS without scheduled stent exchange. Biliary event-free rates, i.e. cholecystitis and cholangitis, were determined at 6 months, 1 year, and 2 or more years. Results. Technical and clinical success rates were 84.6% and 97.4% respectively. Kaplan-Meier analysis showed a biliary event-free rate of 99% at 6 months, 92% at 1 year, and 76% at 2 or more years during a median follow-up period of 564 days, range 200 to 3001 days. Conclusions. Endoscopic transpapillary gallbladder stenting is an effective biliary drainage method that should be considered in selected cases with common bile duct stone where cholecystectomy could not be performed or was deferred. The biliary event-free rates of 76% or more up to 2 years or more further support the use of ETGS in these patient groups.